About 15 million Americans aged 18 or older suffer from depression, which is about 1 in 10 people. With levels of diagnoses like this, it is almost assured that within every person's family or friend group is someone who is currently suffering with depression, possibly in silence. As someone who has worked 5 years in the healthcare field and seen the impact of this issue firsthand, I have decided that this is a topic that needs to be addressed and information that needs to be heard before a real solution can be reached. In this campaign, I will cover why depression is an issue and a solution to help anyone who is suffering. I had a friend who, in my freshman year of high school, was fighting his own battle against depression. Unfortunately, he was not the type to discuss his mental and emotional issues with others, as he was a big football and wrestling star. And I, at the time, was not super well versed in the science of depression and suicidal ideation. However, as I was unaware of his fight, I was also unaware that he was losing that fight, and thus committed suicide. Looking back, there are many signs that I could have used to help him, but hindsight is 20/20, and now I just want to make sure that others do not have to feel this way that I felt being the unaware and unhelpful friend, or the way he felt in losing that battle alone. Depression is a very widespread issue, and yet many people who suffer do so in silence because of fear of stigmatization, such as it being shameful or weak that they suffer from a mental disorder, or that it's all in their head and not a legitimate mental concern. According to Lewis Wolpert at the Oxford Journals, stigmatization of depression causes many different but equally damaging issues, such as people not willing to come forth about the issue and get the treatment that they so need, or being partners or friends being embarrassed to talk about the loved one's issues, whether it's with a healthcare provider or to the loved one themselves. Or maybe some people just are deemed too well off to have depression, but depression is not biased. Any person in any socioeconomic status, of any gender, within any sort of lifestyle, can be suffering from depression. And 80% of people with symptoms of clinical depression do not receive the targeted treatment for the disorder, which can cause an intensification of those symptoms, which are not only mental, but also a deterioration of other aspects of the body, such as weight gain, heart conditions, decline in the immune system, or sleep issues. A solution is needed to start the healing process and reduce the chances of these additional symptoms from taking hold. The first solution is one that sounds fairly simple in concept, but difficult in practice. A willingness to learn the signs and symptoms of depression, both within ourselves and in others. Some of those signs and symptoms are irritability or changes in appetite, fatigue, difficulty concentrating, persistent sad or empty feelings, sudden unexplained changes in emotion, or loss of interest in hobbies or activities. Of course, there are many more signs and symptoms to learn, but this small list is just a starting point for research and education to become more aware of this issue, as self-education is really the best way to put this solution to work. If more people are aware of the signs and symptoms of depression, it will allow for early treatment to prevent the symptoms from spiraling out of control, with treatments such as medications, therapy, or lifestyle changes. But don't get frustrated if one of these therapies doesn't work right off the bat. There's different solutions for everybody, and it's not one size fits all. It's also important to look into facilities that focus on depression near you, or even go to a family doctor who can just send a referral, as they can provide the much needed professional aid and information about the topic. If those who do not have depression can learn the symptoms, they can recall dealing with some of them on their own, and then imagine dealing with all of these symptoms all the time, thus reducing the thought that having depression is not a legitimate mental disorder. With this reduction of the social stigma and a more lookout for the early warning signs, people with depression may feel more willing to come out and get the support and treatment that they need. And they can feel that they have friends or family support group that is not embarrassed or dismissive of their condition. As Dr. Mikhail Bedell from the Cascade Medical Center said, the first step to healing is getting in and talking to a professional, even if you don't think you need it. About 80% of those who receive treatment for depression begin seeing positive results within 4 to 6 weeks of receiving treatment. And over half of those who did not see the positive results did not follow the healthcare plan and thus did not take the route that the healthcare provider deemed key to their health. Real fight against the depression cannot begin until people like you begin to take their part in learning about the issues and the elimination of the stigma to help loved ones get the treatment they need. By becoming knowledgeable and providing help to those who suffer, you can become a more trusted part of that person's life, someone who they feel they can rely on to listen to and to care about their issues without fear of judgment. Start the education progress to reduce the stigma so you can provide help to that one person in 10 who may be silently fighting depression and possibly losing that battle. Help save a life. Fighting depression is like being lost, alone, and scared in a forest. Learn about the issue, and you can be the one who can show that person the path to safety and security. Thank you.